Good evening, Mr. Smith. My name is Mckenzey Davis, and I'm going to be your student nurse for today. If you could you please state your full name and date of birth for me, please? Thank you. Before we get started with this procedure, do you have any known allergies that I should be aware of? No? Okay, good. Today we're going to be performing an NG tube, which is a nasogastric tube, meaning that the tube will be running down your nose and into your stomach. This tube is going to ensure that you're receiving the proper nutrients, as you have been unable to do so since you have not been able to ingest anything by mouth. The name and date of birth has been confirmed. I'm now going to raise you up to a 45-degree angle into a comfortable working height. The angle of the bed is at 45 degrees. This is an invasive procedure, so if at any time you feel any signs of distress or show any signs of gasping, coughing, or you cannot talk, or any signs of cyanosis, then we're going to halt the procedure. Okay. I'm now going to measure the tube. From the tip of your nose to your earlobe and down to the xiphoid process, which is right here. I'm now going to place a piece of tape on the tube in order to know when to stop pushing the tube up your nasal cavity. I'm now going to check your nostrils for which one you can breathe out of better. So if you could, breathe in. Okay, other side, breathe in. Okay, we're going to be using the right nostril for this procedure. I'm also going to place this towel over you in case you feel uncomfortable or show any signs of nausea or feel as if you're going to vomit during this procedure. I'm now going to lubricate the tip of the tube up to 2 to 4 inches in order to allow easy access down the nasal cavity. We're about to get started. If you could, please lift your head back for me. We have reached the pharynx, and I'm going to look inside of your mouth to see if there are any signs of coiling. There are no signs of coiling, so I'm going to get you to sit up forward, put your chin to your chest, and I'm going to give you some water, and I want you to sip on it. Every time you sip on it, I'm going to push the tube back a little bit further. So sit, sip, sit. At this time, I would push the tube all the way up to where the tape is, but unfortunately this mannequin does not allow me to do so. I'm now going to place a piece of tape slightly on the nose, and we're going to send the patient off to x-ray in order to check for proper placement of the tube. So we just got confirmation that the tube is in fact in the correct spot. So I'm going to remove this piece of tape and I'm going to place a more secure piece of tape on the patient's nose. I'm going to crisscross it. piece of tape has been secured. I'm now going to place a piece of tape on the tube to the patient's gown. If you could, please look to the left for me, please. I'm checking to make sure that the tube is not too tight. And you can have full range of motion. Okay. Tube has been properly secured to the patient's gown. I'm now going to remove the metal wire used for x-raying purposes, and I'm going to connect this tube to the proper feeding dosage in order for the patient to receive proper nutrients. I'm going to clamp this back on. Within a couple of days, the doctor has came back to me and told me that you have received all the proper nutrients that you've needed over the past couple of days, and it is now safe to remove the tube. So at this time, I'm going to clamp the tube. I'm going to remove the tape from your clothing and your nose. And I'm going to get you to hold your breath for me as I remove the tube. Okay? So go ahead and hold your breath. I'm now going to properly dispose of the tube. I'm going to put the patient down at a working height that is more comfortable for him.